welcome back. Tonight we're going to be talking about the comorbidities or connections between chronic pain and sleep disordered breathing. So there are a few key points that we need to keep in mind. Patients with primary headaches or facial pain are at high risk for sleep disordered breathing and vice versa. The high comorbidity of sleep disordered breathing and chronic facial pain and primary headaches is not limited to just adults. Children have the same or even a greater risk for this relationship. And when we screen a patient who's reporting chronic facial pain, a primary headache, or has signs and symptoms of sleep disordered breathing, we should be screening for all three of these at the same time. They are no longer going to be one topic that's just out there on its own, and we need to be treating it that way. So first off, let's look at craniofacial or TMJ disorder and its connections to obstructive sleep apnea. Pediatric OSA or obstructive sleep apnea in non-obese children is a disorder of the facial or of the orofacial growth. So if we're not breathing properly, it says it right there, our face isn't going to grow properly. It's going to have alterations that are going to last the rest of our life if corrections or interventions are not taken. Also, unilateral nasal obstruction indicates morphological changes of the mandibular condyle. So, research is showing that basically if I'm not breathing out the one side of my nose, one side of my joint condyle is not going to grow or be shaped correctly, and I'm going to have lifelong issues with that. So interventions need to be made. We need to look at these things on a systemic level, not just a little localized. This is something that we need to pay attention to. So the next topic that falls under this category is unilateral nasal obstruction. And it indicates that there's a morphological change in the mandibular condyle, or the little round part of the joint jaw up here. It affects the maturation of the jaw opening reflex. It affects the development of the primary face on the motor cortex of the brain, and during later periods of growth, it affects the craniofacial muscles themselves. So long-term muscle imbalances with a form meets function issue, it's throwing everything off. So airway is vitally important to the growth and the development and maintaining the function of our face as a whole. Now, anytime that we're talking about obstructive sleep apnea, everyone expects us to get into intermediate hypoxia, and that's just where the oxygen saturations are low. Um, when we're going through these phases, there is also a mandibular growth retardation, so the jaw does not, or the mandible does not grow to its full potential, and it also causes craniofacial morphological changes. There's a really interesting book out there. It's an oldie but a goodie called Why Raise Ugly Children. And I'm not saying that that's what you're choosing to do, but if we're not allowing people to breathe or ourselves to breathe and we're ignoring signs and symptoms that are going forth, there will be long-term ramifications that are going to affect the growth, the form, the function of our airway on a major scale. And then lastly, in this section, I wanted to talk about the established relationship between obstructive sleep apnea and temporal mandibular joint dysfunction, or TMD. When we have an increased prevalence of TMD, we're observing an equal increase in prevalence of obstructive sleep apnea. They're calling it a bidirectional effect because when we treat the airway disorder, the sleep breathing disorder, or obstructive sleep apnea, or however you want to address it, we're seeing that the prevalence of TMD symptoms is also declining. So that is phenomenal news. That means that there is hope out there, that if we're having these joint pains and dysfunctions, and we are in that population of people that have these comorbidities, that getting muscle work done, getting treatment, being on some form of regimen, that there can be some hope that reducing the pain as well. It's not just, a 30 years away problem. I don't want to be on a CPAP when I'm old, but do you want to be in pain today? Do you want to be in even more pain later? Just to kind of get into the onset of this. 1 in 6 adults who visit the general dentist during the last year experience chronic facial pain. 1 in 6 sounds like a lot, but when we step back and we look at the research, we're seeing that 1 in 6 children or adolescents has a clinical sign of TMJ disorders. Over 23% of preschool aged children have pain when chewing in the jaw joint, and there are noises. And by the way, all jaw joint noises are pathological. So yes, today it's just a click when you open and close. It hasn't ever hurt you before, but there's something in that form function relationship that's not working. Something is not in place or something is moving incorrectly. And after a decade or two of that damage and continuing to allow it to happen and not changing the direction that it's going, those pathological signs are going to come and ram their little head up and say, now we're going to deal with the pain side. Don't let pain be your only motivation, but know that just because you're not in pain today doesn't mean that it won't be there down the road. So one of the really interesting things that I seen is that on some of the research they were linking young women with a low BMI were found to have high rates for multiple sleep disorders and TMD. So I love that approach because everyone thinks of someone with sleep apnea as their grandpa, their uncle, their dad with a big aviator mask. And of course, the only reason they have it is because they're overweight. But we learned a long time ago that that's not true. And if your doctor's still saying the only way to get rid of it is to lose weight, you need a new doctor. But they're looking at the correlation between bruxism, or clenching and grinding of the teeth. 67% of people that were clenching and grinding had a sleep disorder and had symptoms in the TMD, or temporomandibular joint dysfunction. 37% of these women had some form of insomnia, and 23% were already diagnosed with obstructive sleep apnea itself. So there's a huge correlation. It doesn't matter what sex we are, it doesn't matter our age at all. It's there, and we're seeing more and more of it. Alright, so let's get into the primary headaches and obstructive sleep apnea. Headaches are the most common neurological disorder and one of the most frequent symptoms. The rate of headaches in children are up 51%. A migraine is a highly prevalent disorder currently estimated to occur in 10 to 18% of the population worldwide, while a tension headache prevalence is 52%, and the female predominance in all headaches emerges at puberty, which is extra fun for all of us. Migraines happen when intracranial vascular swelling that results in compression of the A delta and C fibers in the pia mater that surround the blood vessels in the meninges along with peripheral inflammation in any branches of the trigeminal nerve that results in central sensitization at the nucleus caudalis of the trigeminal tract. So all of that is a very fancy way of saying that we've got vascular response. Okay? There's a lot of ways to get through that. There's a lot of things to create a pump. There's a lot of different modalities out there to help deal with them, and a lot of people find different levels of success with each of them. When we're looking at this as what it is, migraines do have a genetic predisposition. So if your family lineage has issues with vascular response, absolutely it's going to be there. It doesn't mean that that is the be all end all. You have to live with it. You can get care. You can seek help. It is going to be higher in the female sex. That doesn't mean that men don't get it. It is going to increase with depression, but think about it. If you're having chronic migraines, if you're dealing with pain, who's not going to be depressed over it? And vice versa. If you're dealing with long-term chronic depression, you're going to get headaches, and that might cause a vascular response because as we release different hormones in our system, we have vascular responses to many of them. There is a link to coronary heart disease, chronic obstructive pulmonary disease, ischemic stroke, and hypertension. So these are not things that we want to ignore on any level. It's not like an acceptance of, this is what my mom dealt with, I should live with it too. No, don't carry that burden. Seek help. See if you can relieve the pain on yourself. And hey, your daughter doesn't have to deal with it either, because if once we restore breathing and we get proper oxygen flow and we reduce that vascular response, there is hope. So children diagnosed with a migraine are 8 times more likely to have a sleep breathing disorder. Whoa. But children diagnosed with chronic tension type headaches are actually 15 times more likely to have a sleep breathing disorder. I mean, that is interconnectivity. That is showing comorbidity. We've got to get everyone breathing, whether it's grandpa or young Johnny. We've got to get these kids breathing. We've got to get the form in the face correct. That way they can have proper airflow so they can establish growth and development and actually function as humans. Let's look at chronic widespread pain and peripheral neuropathy when it comes to sleep disturbances. Chronic pain, including musculoskeletal and joint pain, neck and back pain, affects about 20% of the adult population worldwide. I really thought that would be higher, but I will accept the research numbers for now. Fibromyalgia is a subset or a specific diagnosis as one of the main causes of chronic widespread pain. When we look at pain as a whole, it has been found to be the most important determinate subjective measurement for quality of sleep. That means if you ask someone how they slept, instead of saying, I got, stage 4, stage 5 deep sleep, was dreaming, I tossed and turned all night, or I had aches and pains, or woke up stiff, things like that. So that's a huge subjective measure. It's how we perceive our sleep. It's how our body is also going to heal in response to it in some levels. Some of the associated symptoms that I see in patients are going to be fatigue, sleep disturbances, difficulties with memory and concentration, irritable bowel syndrome, headaches, and depression. According to the CDC, approximately 60 to 70% of people with diabetes also have a comorbid neuropathy and sleep apnea. This is a significant link that it's been significant than the link between the incident rate of diabetes. When we look at chronic intermediate hypoxia and recurrent arousals from sleep, whether we're trying to our brain is saying, hey, I need more oxygen, we're seeing neurohumoral changes resulting in metabolic disturbances, including insulin dependence, completely independent of other known risk factors. So you can be that healthy, doing everything right person, no family history of diabetes, not drinking 15 sodas a day, but you get really poor sleep and your body's not healing and you're not getting that restorative rest that you need, and we start seeing those oxygen saturation go down. Every cell in the body again needs oxygen. It's not able to function without it. Now we're seeing that there are an increased risk of diabetes just from fatigue. I mean, we're doing all of these things and the pancreas is working as hard as it possibly can. There is a point of fatigue for everything. And when the pancreas goes, it's called diabetes. Our next topic is insomnia and chronic pain. There's a high prevalence in chronic insomnia amongst patients with chronic pain and has been well established in the research with reported rates of insomnia as high as 88%. Musculoskeletal pain stimulates the sympathetic nervous system, resulting in sympathetic dystrophy, which results in sustained stimulation of a sympathetic state. This condition presents with a high stimulation of the adrenals, producing an increase in cortisol, which accelerates the metabolic rate, increasing our heart rate and blood volume. This condition prevents a restful transition to sleep and contributes to insomnia itself. In this frightened state that our brain is stuck in, the patient exhibits dilation of the bronchioles for increased oxygen intake and dilation of the pupils for optimal visual acuity. Blood is deviated to the vital organs, meaning the heart and brain, and that's for optimum function, so you can be very observant and ready to run because our brain thinks there's a bear, which might sound great. This results in peripheral vasoconstriction, so it's shutting off the blood flow to the extremities. That way the heart and brain can have everything that they need. And this is going to be seen in a patient clinically as cold hands and feet. So we'll be talking to these patients, they're just having trouble sleeping, and a lot of times they'll have people sitting in front of me saying, well, if I could just get my feet warm, I'd be able to fall asleep. And I'm like, yeah, we're in this sympathetic state, and I can talk circles around it, but we just needed this deep dive so that everyone can be on the same page. Another big thing is gastric peristalsis is reduced. In the sympathetic state, it results in abdominal discomfort and pain. Sympathetic stimulation produces microarousal secondary to pain or breathing disturbances and reduces the excessive daytime or results in excessive daytime sleepiness. So there's a fun fact that excessive daytime sleepiness is highly comorbid with primary headaches. So back to our topic from before. One of the reasons I really want you to take a lot of this serious is that when we deal with it on long term as an adult, we kind of sometimes get a blind spot to what it could mean as a child because of like, oh, okay, I deal with this every day. It's probably been there my whole life. But when we look back at children with juvenile idiopathic arthritis or JIA, they demonstrate the exact same sleep patterns, difficulties in maintaining sleep, that pain interferes with their ability to heal and have favorable outcomes with this disease. And these conditions often manifest as jaw pain and result in facial pain. And so, if we've got a kiddo that's saying, my jaw, my face, and all of this hurts, and I'm having trouble sleeping, definitely don't ignore it. Don't let that linger. Next, we're going to talk about sleep-related bruxism, and bruxism is like clenching and grinding of the teeth. The face is a mirror of the body. Facial pain is a result of muscle constricture via central stimulation of pain somewhere in the body and or alteration or interpretation of proper nasal breathing. Increased constricture of the elevator muscles of the jaw, so like clenching, will result in headaches and facial pain. At the same time, holding an open mouth posture is going to result in fatigue of the depressor muscles and result in headaches and facial pain. Overnight clenching and grinding of teeth is classified as a sleep-related movement disorder. Okay, teeth grinding causes a stretching of the capsular ligament of the TMJ. Ligament laxity is an excessive disc movement or perforation of the disc itself, resulting in jaw joint noise. We had talked about earlier how all jaw joint noise is going to be pathological. So when we have the disc displaced with reduction, it's going to be a little bit of a sound, and without reduction, meaning you are no longer able to close, we call that lockjaw. Okay, so sleep-related bruxism can be broken down into two groups: primary or idiopathic, or secondary and iatrogenic, secondary to prescription drugs. A lot of medications out on the market cause us to do some clenching, grinding, or bruxism. Think Ritalin for ADHD. A lot of our antipsychotic medications like Haldol, lithium, Thorazine, our SSRIs, Prozac, Zoloft, Celexa. There's a whole range of the calcium channel blockers and antiarrhythmic medications for the heart. Plus, there's some non-prescription substances like alcohol, nicotine, caffeine, cocaine, and MDMA, just to name a few that will induce this. And so people can self-regulate. We can see, okay, this is secondary to that, and oftentimes it means that we need to make a change. And sometimes we can't change the medication, but we can change the breathing. Or if we can't change the breathing because we have some sort of centralized location or lesion on the brainstem, the medication might need to be altered. But whatever it is, there's an answer, and so there needs to be a conversation going. And then we get to forward head posture. So for every inch that the head is forward from the shoulders, it adds approximately 10 pounds to the weight of the cervical and lumbar spine. So this is not always a headache, it's not always a neck pain issue, but sometimes a way that we carry our bodies, we end up having a lot of that pain in the lower back or lumbar spine area. Forward head posture, in our sense, is secondary to a painful swallow. And we can see this adaptation and injury because you'll see them lift their head or do something to help with that swallow during the day. But then we start, you swallow your spit all night long and we'll start going forward. And it can be seen in daytime, and like I said, with the head movements. This patient who will also wake up with TMJ pain, facial pain, jaw joint inflammation, and now proceeds to postural compensation. There's a cantilever strain on of the forward head posture that results with extension of the neck muscles and will be an acute inflammation for the tendon of insertion for the occiput, so the base of the skull back here. And so a lot of us will see tension headaches that wrap around like a headband. And a lot of that's going to be posturally related. So if we've got an incorrect swallow, we've got bad breathing habits or posture while at rest, then a lot of this is interconnected. Is the whole point here is if we can isolate these down and help eliminate the underlying cause, then why are we going to be on headache medication, seeing somebody else for a migraine, missing days of work? I just wanted to pull this image in because I find it to be very telling when it comes to the trigeminal nerve. It is extremely interconnected, and the pain signals they go like a standard way. So if we have pain in the front of the face, it's going to be carried all the way back to the caudalis nucleus, like we were talking about earlier, down to where the C1 through C3 nerves exit the spinal cord, and then interpreted back up. And so there's this really interconnection between referred pain, and a lot of people struggle with knowing the difference between my teeth hurt, I have a sinus infection, I have a headache, I can't tell if it's on the top or the bottom part of my jaw. That is perfectly normal, and I just want you to take this image here and take a moment to understand it, because there's a lot going on. And then this is the kind of the image that I made or remade that shows all the interconnectivity with just sleep apnea alone. So, daytime drowsiness. We're used to that. We see these people. Let's see who falls asleep in every waiting room that there is. Hypertension. Yep, we talked about how our blood volume's going to go up, our heart rate's going to go up. It's going to cause all of this to change. These people are going to be now more prone to heart attack and stroke. Memory loss, absolutely. How many of us go and we walk into another room because we're mid conversation and we're not breathing properly, and we get the doorway of, why am I in this room? Well, stop, breathe, and think. Diabetes, we talked about that role with the changes in fatigue of the pancreas. Depression, absolutely. When we're not breathing well, we're not thinking well, we're not sleeping well, we're probably going to be having some depression, and that's going to be bidirectional as well. Insomnia, we talked about. So my big thing that I talk about people with insomnia is that it's not like a struggle that I don't want to go to bed. It's my brain is smarter than me, and it's going to think of the worst thing possible right before bed. Whether that be what's going on at work or with your relationship, your brain is going to bring all of those memories to the surface for you and let you kind of just take a deep dive and say, if I don't let this person go to bed, right, then I get all the oxygen that I want. It only lasts so long, and then you start having signs and symptoms of sleep deprivation. We're not getting quality of sleep. We're not getting into deep sleep. Once you do go to sleep, some of the other things kick in because, we heard about restless leg syndrome forever. And then it became restless body syndrome because your brain's not getting enough oxygen. You're going to kick. Might not wake you all the way up, so that's one of those micro arousals that we talked about. Might wake your partner up. If kicking's not enough, not keeping you awake's not enough, then we start going to the restroom multiple times a night sometimes because you've got to get up, you've got to move, you've got to breathe. And it's not like you're waking up necessarily gasping for air. It's your brain saying, hey, you're almost to that point and I don't want you to get there, so I'm not going to let you go into stage 4 or 5 sleep. You're no longer going to be dreaming. And all of these things that add up to chronic sleep deprivation brings us to that last category, which is early death. It's not where we want you to be. It's not where we want your kids to be. And I would love to be able to work with all of you on this. I am still offering complimentary consultations. Let's look at what the tongue, the face, the architecture inside the skull is telling us. See what your individualized needs are and address them one by one. Let's restore nasal breathing. Let's restore proper resting lip seal. Let's put your tongue where it's supposed to be. So many people have never had postural tongue training. And even for me, when I first started, it was very fatiguing. But I can feel a difference. I can feel the air that's there now that I did not have before. And so I feel the hope that I can bring to other people, and I really hope to see more of you and help you along this journey and get things started. Thank you for joining me tonight.